Okay, welcome everyone. In my last video, I said that I was going to be having an interview in the near future with one of my colleagues, and that is happening today. So I am going to introduce to you Dr. Diana Forno, and have her tell you a little bit about her credentials and what she specializes in. And then we're going to have a conversation about how trauma or childhood experiences can have impacts on the immune system or health issues. So, Dr. Forno, would you tell us just a little bit about what you do for a living, what your credentials are, and particularly just what you're interested in and like what sort of work you do?
Okay, thank you. Thank you, Beth, for this opportunity as well. And I'm glad to be part of, all this body-mind wellness. I'm a physician. I'm a general practitioner, and I'm licensed a physician in Guatemala City, Central America. Um, and I specialized first in public health. So I've worked with global health programs for about 20 years now. And besides doing public health, I also have worked in integrative medicine methods. And that means, it's just body mind kind of therapies. So since 2010, I started training in these practices, biological decoding and family tree analysis. And basically, this would help me look at my patients in the clinic, see them with a different perspective, not only the physical illness, but also looking behind it, all the emotional issues that they have. And after that, I also train in AIT, which is, I think, one of the most tools that I use. I use several tools, but AIT, it's great, Advanced Integrative Therapy, because this helps me, treat the patients with chronic disease like cancer, diabetes, hypertension, and others, and really heal, entirely, not only physical, but emotionally and spiritually, anything that is behind their disease. And they learn how to read their bodies, understand why they got sick. And, you always need probably your medications, of course, or surgeries at the time, especially with the cancer. But AIT helps release all the emotional charge that is, from this disease. And not only being sick or how it began, but also we look at the experiences that they have, the traumatic events that are related to their disease. And I'm sure we'll talk more about that in a little bit. But basically, that's what I do. I've been since 2010. Like I said, I use all these techniques in the clinic to help patients just in their wellness get better.
And I would speak from my experience that it is not common for medical doctors, maybe it's just in the US, but for medical doctors to take some of these advanced trainings to have a holistic healthcare approach. Because any of my clients, just speaking from my experience in my private practice, as I began to do more somatic or body-based trauma treatment, because I was finding that there were some clients that could be helped very much through talk therapy. And then I would have clients where no matter what we talked about, there were ways that they felt about themselves, others, or the world, or the traumatic reactions that they had that would not respond to talk therapy. So then as I became more of a specialist in complex post-traumatic stress, I also started to see that many of my clients with complex post-traumatic stress had things like fibromyalgia or endometriosis or polycystic ovarian syndrome, PCOS.
Yeah.
Um, and migraines are a super common one for my clients with complex post-traumatic stress disorder. But what I also would have to hear them talk about and we would process as traumas is their experience of trying to get medical interventions and help and having medical doctors go, well, these symptoms are mysterious, which must mean that you're making them up because I don't understand them. So, come back with something that I understand and I'll treat it. And so, my clients were having kind of what would feel like a recreation of their trauma, which is somebody going, there's nothing wrong here. The only problem is you, not a real physical health illness or malady. And so I'm wondering if you could just speak to what is there's a correlation, maybe not necessarily the causation, but how do you explain to your clients the connection between adverse childhood experiences and chronic health problems in adulthood?
Mhm. Yeah, thank you. And I think it's important to know this because a lot of people need like the full explanation or the scientific evidence behind it, of course. And there has been studies, and the greatest study was the one CDC and Kaiser Permanente that did on adverse childhood experiences that shows the connection. These people that have the adverse childhood experiences, the ACEs, like violence, abuse, neglect, um, as a child, then they would develop all these different physical illness, but also mental illness and different risky behaviors, alcoholism and drug abuse and such. So it has been already, proposed in all these studies. You can see the evidence that there's a relationship. And basically what I explained to them is like, when you have these ACEs, you are under huge stress, so the stress response in your body is prolonged. You have it for a long time, usually sometimes years. So with especially with patients with cancer, I've seen that they've had this, they've been in an abusive home for a long time. So their body is under this stress response for a long time, and that later on translates into all this damage in the body and in their brain and in all the responses, their immune response, the cortisol is high and all of that we've seen already in many patients. And that's why I explained to them we really have to go and treat these traumatic events and the connection to the recent ones in order to heal profoundly, deeply this disease that they have.
Yeah, and I also think about because I am not a medical professional, I am a licensed professional counselor, but because I have seen, I had to become more of a specialist because I was seeing so many clients with this chronically elevated threat response in their body. And so the way that I also like to explain to my clients is that if you begin to start to associate more and more things as dangerous, then more and more things are triggering your threat response in adulthood, and something that our brains or our nervous system can't really tell the difference between an imagined threat and a real threat. And so if I get cut off in traffic and I nearly have a car accident, I get that shock and the spikes of the cortisol up and down my forearm, so I can feel my body's threat response. But if I get an email from someone telling me that I have made a mistake, I will get the same response because my nervous system, my limbic system cannot tell the difference between a viable, real life endangering threat, like getting cut off in traffic, and the perceived threat of abandonment or losing status or something like that. And so the more that the stress response, the more triggers you have to react in the threat response, the more often you are in this kind of chronically threatened, elevated state. And so would you speak a little bit about the parasympathetic nervous system and what, or sometimes people are familiar with fight or flight, which is the sympathetic nervous system, and rest and digest, which is the parasympathetic nervous system. Could you speak a little bit about what role the parasympathetic nervous system plays in healing or the body repairing itself?
Yes, and when I explain this to my patients, it's easy to first, the important thing to know is that these responses from the body are natural and they help you out, right? In a normal situation, you need this stress response to react or to be safe. Just like you say, if you're in traffic and you have to put the brakes on really quickly, that's automatic, right? And that's your stress response working, but just for a little bit period of time, a short period of time, and can save your life. So it's good to have this, but when you have it in a long term, like you say, then your body doesn't know when to stop. And then you get all these other problems. So you have your sympathetic nervous system, and that's when you are in alert. That's how I explain to them, like when you are alert and you have to be ready to either get out running, or sometimes you freeze, the flight and fight response. But how everyone can react differently, but you do it, mainly the body does it to prevent harm. So, it's really helping you out, because some people get really upset about this and get, angry with their bodies or why they're sick. And I try to explain, this is a normal response, but because of all the experiences that you had, this is the way it's reacting. But the good thing about the body is that, we always, our default is to be healing constantly, and our cells don't just follow instructions, and but this is what it does. The body is always healing itself. So that's the good thing. We have to go into that. And for that, we need to be in our relaxing mode, right? And that comes with the parasympathetic system. We need to relax in order to heal and to our cells to be ready, for whatever comes next. So getting a balance, finding the balance, I think it's the important way to heal. Mm-hmm.
And thank you for saying that. Yeah, because a lot of our clients, or my experience is, some of the things that are recommended and everybody knows that they work are things like breathing exercises, meditation, yoga, things that by and large everybody knows they are healthy and helpful. But for some of my clients, the reason that sometimes we have to treat trauma first is because it's not actually available to sit still, because then that might be when all of the emotions perhaps that they have suppressed overwhelm them. And so to just say, why don't you just sit on a pillow for 40 minutes and watch your mind? For someone who has been highly traumatized, their mind and their body both feel like dangerous places to inhabit. And so I was wondering if you could talk about maybe your experience with clients who feel maybe hopeless or despairing about some of their current symptoms, and how you work with them around some of those emotions.
Mm-hmm. Yeah, and it's very difficult, like you say, my patients, most of them, when they come, the new patients, they're not ready to even do a breathing exercise or any meditations. It's a process, and we start very, very slowly, but eventually they get there. And I think it's important also to treat the thing I see with the patients is, the shock. Usually they come in shock because of the diagnosis that they got, and sometimes they have to get past that in order to heal many other things. And for example, patients with cancer, when they come to me and I said, well, I went to the doctor, the oncologist said, I have 3 months to live. I mean, that's very shocking, of course. And sometimes, it's hard the way you have to talk to the patients, but I think we have to start by treating the shock that they're in, the state that they're in. And that way we start treating those emotions that they have in the beginning before we go deeper into the traumatic events that got them into their disease, right? Sometimes we have to start very with the most recent events that happen. Sometimes they have to deal, for example, with the changes in the life that they have by getting a disease, and now they cannot do, a lot of things or activities, or they cannot eat as they used to. I mean, they have to make big changes in their life because of the disease. And so we have to start by treating that, the most recent emotions that they have, or the anger of just having this disease. Why do I have this? Probably that's the first thing that we have to get through before we even go into treating the traumatic events that they have. So,
Yeah, I appreciate you mentioning shock because I think about shock and disbelief and then coming to acceptance, which again, as a as a trauma therapist, one of the things I see a lot is those feelings of despair and hopelessness, which might have been my client's best attempt at acceptance for traumatic circumstances, right? Well, it's not going to get any better, so I might as well just
right.
cover over and try to get through. And then, people who are not traumatized and have a great support system still have to deal with like the shock and pain of a diagnosis of a shocking diagnosis. But someone who may also have some of these root feelings of despair or hopelessness may feel that a new edition of a chronic health issue feels like confirmation that they are never going to get an opportunity to experience peace or freedom in this lifetime. And so I'm glad you mentioned kind of just processing things in the present, because there are good days and bad days when it comes to being and healing
Mm-hmm.
from adverse childhood experiences or complex stress. And on a bad day, that despair or the hopelessness just feels like the truth. And I was wondering, you mentioned spirituality before. One of our colleagues, Dr. Greg Browns, who I hope to be able to interview at some point in the future, is the one who introduced me to the idea of the biopsychosocial spiritual model of
Mm-hmm.
healing. And I'm wondering if, like most people might know, the social and the biological and maybe even the psychological, but could you
Yeah.
speak on how spirituality is a part of like health, well-being, or even the healing process in your own experience?
Mm-hmm. Yeah, and I think that's a very important aspect of the disease because for most patients that I've seen, especially with cancer, um, they have to talk about their spirituality, and most of them have either, you know, because of their disease, maybe they have, if they had a belief before, now they lose their faith or something like that because of the disease. Sometimes it's directly related to their disease, but sometimes it could be another situation that, they lost faith or any beliefs that they had. So we talk about that and treat it as a traumatic event. And as you know, in AIT, the protocols for cancer have many protocols, but they have biological, psychological, and also spiritual. And we look at that, because it's important when you're healing to heal also your spiritual life. And some people maybe lost their faith, like I mentioned, doesn't matter which faith, but every time we do the treatment, they always start practicing, their spiritual practices that they used to do, and that really helps out for them to have faith and to have that hope, like you mentioned, because the most important thing for someone to heal is to feel hopeful. I mean, if you lose hope or faith, then it's really hard to heal and to go through the process. So I think it's really important to also look at the spiritual side of things, no matter, what beliefs that they have. But it's important to practice something spiritual during the healing process, I think.
I once years ago was on a podcast with our colleague Tabitha Birdweaver, which that podcast still exists. It's called the CPTSD podcast. You can find it on YouTube, and I'll link it in on my channel. Um, and that sometimes I also think about our clients who maybe have had religious trauma or who are having that experience of somebody saying, well, we're gonna you have to have uh a faith practice of a certain kind, and then God's going to heal you. And what I'm hearing you talk about is kind of the reconnection to hope is a spiritual practice, and the belief system necessarily is not what matters at all, as much as
Right.
like having a practice of I talk to my clients a lot about this idea of spiritual surrender, which if they have been traumatized or had abusive caregivers or someone who hurt them, that idea of surrender sounds like being crushed. And we're asking, maybe consider that surrender could feel like floating on the top of like a body of water and just being able to feel held by that. But that there's, I think about that shift from having to submit your will to something higher versus releasing or relaxing into like hope or the belief that things are
Mhm.
happening in a way that are for your learning. Man, that's
Yeah.
a complicated concept.
Yeah. And for some people, even a spiritual practice could just be going out and being in nature, reconnecting with the earth, and that's a spiritual practice that can heal, definitely. Just thinking that you are part of this, big world, that you are connected, and just feeling the connection, the hope, the faith, all those qualities that are needed in order for you to heal. Um, so different spiritual practices could help out the patients. And I see that in all of them, it really helps them during the process.
There's a human behavioral biologist. His name is Dr. Robert Sapolsky, and he wrote a book called Why Zebras Don't Get Ulcers. And it was talking about how human beings store stress because we've all been kind of conditioned living in this developed world to be kind of in the threat response all the time, and to not go from like you were talking about, threat response is meant to be a short-term spike for your survival and then the resolution so that you can get back into the relaxation response. And he has a video online where he talks about religion is actually nature's antidepressant, what
Mhm.
power it is to believe that there is like someone or something that you're connected to or that's looking out for you. And what I really think is sweet is he's not saying, I'm not pushing this agenda, I'm an atheist, but the research just shows that it like
Right.
really changes your brain. um so Dr. Forno, I'm getting the impression that we probably could talk about a lot. But rather than getting into a massive amount of depth today, maybe it would be better for us to see about a part two. And just
Sure.
in very brief, the last thing I would ask you is, can you talk about what toxic stress is?
Yeah, okay. And as we mentioned, this stress response that is normal, it could be positive, and a quick example could be like when you have something that makes you nervous and stressful, but it's good, it's positive, you're getting an award, or maybe, you know, uh, when your son is having a graduation or something, those type of things that you get stressed about, but it's in a positive way. Those are good, and your body would increase the heart rate and all of that make it possible for you to move and do the activity. But if you escalate, then if the stress response is a little bit longer, or maybe temporary stress, it could be tolerable. You could maintain the response, but it could be buffered when you have some type of support. You have people that support you, and this could happen like if you have to happens with the migrants, for example. I could think it's a temporary, it's not just one day, it's a situation, very stressful, but if they get the help that they need, the support, they can get through it easier. And then you get to the toxic level, and this level then is when it's prolonged, the activation of the stress response, like we mentioned in childhood, when you have violence, the domestic violence, for example, or abuse, any type of abuse. And also there's an absence of this buffer. You don't have protective relationships, you don't have protective adults that could buffer and help you out, get through this stress response. So that's the toxic level. And this toxic stress, this is what we're talking about, that it's gonna affect your body and your mind, definitely. And it has long-lasting consequences.
Yeah, thank you so much for summarizing that so clearly and succinctly. Because someone told me once that there's distress and there's eustress, and that eustress is that kind of stress where there's something positive that's going on, like you're going to play a sports game and you need that activation. Oh, Doc, I think I might have lost you. And so there's distress, which is to react to something that might be dangerous. I've heard the word eustress, which is like EU, which is like, I need to play sports, or I'm going to go stand up in front of a room full of people. And like,
Right.
the activation that I'm getting is helping me be kind of at my best performance. But this toxic stress, hearing you talk about the lack of somebody to help you move through the stress, is also one of the ways it sounds like it gets stuck with you having to kind of cope with it all by yourself. And so maybe the next time we see each other, we could also talk about kind of how trauma related dissociation is the best way to cope with toxic stress in the moment, if you have no buffer, if you have no resources. But then it becomes the pattern of how to respond to stress, which is it comes in, I am unconsciously pushing it down, kind of metaphorically, into my body, versus I feel it,
Yeah.
I move through it, it has a beginning, a middle, and an end. It's coming in and I'm pushing it down and then saying, it's gone now. But
Right.
what we know about emotional suppression, or the prolonged stress you're talking about, is that it can manifest itself into chronic health issues.
Yeah.
Okay.
Definitely.
I just want to thank you so much for taking the time out of your day to speak with us about this. This is really, what we do for a living, and we think it's so interesting, but it's always so fun to hear someone with a science mind sort of back up or confirm some of the. I'll read a research abstract most of the time, but I'm probably not going to read the whole study. However, I will cite and link the study that you mentioned, the CDC.
Yes, that would be good and interesting
Just
for people to
the
look at the evidence.
Yeah,
Mhm.
stress. And then if anybody really got a lot out of this, or has more questions, or would like us to broach a particular topic, maybe when we do a part 2, please just put that in the comments underneath the video. All right, Dr. Forno, thank you so much for taking the time to
Thank
be here.
you.
Yeah.
It was
Okay.
good to see you. Bye.